Now, are men facing a health crisis? That's what Valley MP Nick Fletcher believes, and he's raised the issue in Parliament, calling for the government to introduce a men's health strategy, and we're delighted to say that he joins us now. Nick, thank you very much indeed for taking the time to join us this morning. Why do we need a men's health strategy?
Well, the statistics for men are really quite appalling. I mean, 13 men a day are taking their own life through suicide. 88 men are dying prematurely with heart disease. 33 men a day are dying of prostate cancer. 95% of all workplace deaths are men. If these statistics were any other demographic, there'd be an outcry, and we need to sort this out, and we need to look at it as soon as possible. This is urgent.
I mean, some people say that the health service was built by men for men, and therefore that's why we don't need a men's health strategy. And why we need a women's health strategy. So what do you say to people who say that?
No, that's wrong. I mean, as I say, the statistics are proof for themselves. Men just generally don't tend to look after themselves, which is the way that we are, and we don't have the reasons to go to GPs and as often as what many women do. It's just the way that they are. I know many men who have not been to see their GP for maybe 5-10 years. It's just not something that we do. There's no reason for men to go. Women have lots of different reasons to go.
Nick, do you not just need then an awareness campaign rather than a health strategy if it's about making men aware of their sort of medical needs? Is that just not what you need?
No, I don't think it is. I mean, it's okay. I mean, we can highlight lots of things, and I think that's what we tend to do a lot of in politics. We highlight these things, but then we don't actually move forward with anything. It's okay highlighting them, but I mean, if that's all we're doing, where's the gain? And whatever we're doing at the moment is obviously not working. Otherwise, I wouldn't be able to read out the statistics that I've just read out.
Any discussions with the minister about this? And if so, what have they said? How likely are the government to introduce a men's health strategy as you're urging them to do?
Well, the previous health secretary was very positive towards it. Obviously, we've had a change, but I met with Maria Caulfield on Wednesday this week, and she's open to the idea about it. I do believe we need a consultation period first. I think that's important. We've done it. This has happened for the women's health strategy. There was a consultation piece done, and the women's health strategy is coming to place now. And I think they're just in their first year with that, so they are hoping for some success there. And we support that. I mean, it's important that we have a health strategy for women, but it's equally important that we have one for men too. And we wouldn't be the first country to do it. I mean, there's one in Ireland, there's one in Australia, there's one in Canada too. So it's something that the rest of the world is beginning to recognise.